So,
Take it away.
first of all, my name is Vitold, and I'm a founder and CEO of ECC. And let's just get down to the chase, since I already wasted some time on on my mute. So, we're working in the pharma industry. The company has started its activities as consulting, but now we're moving into a product development. Um, I'll start off with the problem. 95% of the world's population have some kind of health issues. And even though our medicine has gone a long way since 100 years, there's still more to go, because every year more than 500,000 people actually die from medications. That means that there are inefficiencies here and there, so to say. And more than 55% of American population are taking some kind of drug regularly. And those drugs are most of the time RX, which means prescription based. Um, Now, for the market opportunity, first of all, RX market on its own and only in US in 2016 was worth $4.5 billion, which is quite decent, and it's only growing. And mobile application users, there's over 500 million of them since 2015, and that number is growing as well. So there's an immense opportunity when it comes to digitalizing pharmaceutical world, so to say, because this has been a rather slow progress for that industry. We actually started off consulting in there, and now we're actually trying to take a next step in the product development. Now, our main idea is to develop a platform where pharmaceutical companies and patients have ability to communicate. This might seem silly, and people might ask, why would anyone need that? Well, at the end of the day, I already mentioned to you that there are issues when it comes to drug efficiency. And there's also issues on the pharma side, because pharmaceutical companies have no clue who are their patients, how are their patients using the medicine, why are they using it, etc. Because today everything is handled by middlemen, so to say, and that causes quite a big problem for pharmaceutical companies and for patients as well. So another great opportunity is personalized medicine that we're looking at. Now, our plan. So first of all, we already started, because we're a consulting company and we're working with pharmaceutical companies, we already started talking to pharma companies about this idea, and they absolutely love it, because they have never thought that this idea is going to be possible, I would say, rather sooner than later. So right now we're discussing with them on the best ways how they can connect to their patients. So in our idea, we have this platform. Well, we don't have it yet, but our idea is to build a platform which will allow patients to directly connect with pharmaceutical companies. Now, that's going to go via doctors. As you guys already know, telemedicine is a big thing and is getting even bigger, especially due to today's situation. So we're using this opportunity to work with our current customers and understand how patients can connect with them. Now, the idea is that via telemedicine, as you probably know, pharmaceutical companies have their own sales reps that go and sell medicine to doctors, and then doctors prescribe those medications to patients. Now, the idea is that doctors would be able to do very similar thing via telemedicine, but they would all be connected under one umbrella. So when a doctor writes you a prescription, that prescription is processed by our application, and then via the application, the patient can order the medicine directly to their house. So technically, once a doctor prescribes it to you, you get the prescription, you order the medicine, and that medicine can arrive straight from the pharmaceutical company, because they have this capability.
Sorry to interrupt you here, but we're already 1.5 minutes into the Q&A session, and our judges can get active.
Sure.
I'm sorry, you probably don't see the clock. I'm just letting you know.
No worries at all.
Any questions?
Yeah, gentlemen.
I mean, I know in the UK, the overprescription market is £500 million a year. And there's a big push from the National Health Service to find tech that can reduce the cost burden of prescriptions. to patients. And I think, again, you know, I've mentioned this on a previous presentation. I think you're in the right sector. But the other thing is, in a payor market across Europe, like Germany, Spain, Italy, UK, it's the national health services that you would need to get on board first. And again, you know, where's your strategy for that?
So that's exactly correct. As you say, there are countries who are reimbursing their patients on that, but that can work in a very similar way. And those countries would actually find it advantageous because, as you know, right now the supply chains are actually disturbed, and they need some good and safe way how to deliver that, because right now the delivery is, I would say, quite centralized. So there are a couple of big wholesalers, the drugs go to those wholesalers and then they distribute it. So there's no actual link between pharma companies and patients. And by establishing that link, pharmaceutical companies can know much better how much of a certain drug they need to produce, because then they have the link. They will understand more or less how much that patient is going to be taking. And at the same time, because I mentioned in the very beginning, patients suffer because over 500,000 of them die every year, right? So that gives also an amazing opportunity for patients to communicate with the pharma company and tell them, look, guys, this is not really working for me well. I have these and these side effects. This is something that's been missing. And I think this is a great opportunity, not just for pharma companies to, make their supply chain more efficient, but actually for patients to enjoy a better product.
Thanks for the presentation. I have to jump off, unfortunately, but thank you all for the
yeah,
no worries.
We have 10 seconds left. Anything else you'd like to add?
Yeah, but I think that's not enough time for that.
We'll do it. No worries. Thank you very much for your presentation.
Great, Mark.